Sometimes life throws bold moments at you, like finding the perfect vacation or finding the ideal location. At BOS, we're there to help you meet those moments with bold confidence. So whether it's managing money for future plans or getting what you need to start planning your dream, we're here to bring you a better banking experience. Make the bold move and switch to BOS today.
Hi, this is Ron Kinscherf. This is the Business Spotlight brought to you by the Bank of Springfield, and we have Dr. Philip Meinhardt from Quincy Medical Group with us. You are a orthopedic surgeon specializing in back type stuff, right?
Yes, so I'm a board certified fellowship trained orthopedic spine surgeon.
So why'd you get into medicine? Was there something that happened earlier in your life that?
Yeah, so when I was a teenager, I was an athlete and played football and had chronic knee issues.
Okay.
And ended up having a benign tumor.
Oh, shoot.
Growing off of my femur. And
Oh, wow.
I had orthopedic surgery by a wonderful surgeon who changed my life.
Right.
And that really got me motivated and interested at a young age. And that's what I pursued from there forth.
So you wanted to be a surgeon right away?
I knew.
It wasn't, I'm going to be a doctor, and then you make the decision.
I knew before I left high school that I wanted to be an orthopedic surgeon.
Okay.
Yeah.
And you specialize on backs, right? So how did
Yes.
that, you had knee surgery, obviously, and it's changed your life, as you mentioned, but you decided to focus on backs.
So during my fellowship, our residency, I should say, is 5 years long, and we go through all areas of orthopedics. Spine surgery was the most attractive to me because of the complexity of it.
Every spine is a puzzle, basically, right?
It's all different. The pathology is all different. The surgeries I do are all different. Try to standardize them to standardize the results.
Right.
But see a wide variety of pathology, and I felt like trauma and other things were fairly easy to understand.
But isn't it the most complicated type? I mean, neuro maybe, but isn't the working with the spine has got to be very complicated and hard to find what the solution could be, or am I wrong?
It depends. I mean, that's when I'm doing surgeries, I have a very high success rate when I'm going to fix that patient. So if they have a specific nerve problem and I can look at an MRI and take the history from them and figure out exactly what nerve is involved, look at that MRI, see compression of that nerve, I can relieve those symptoms 98% of the time.
Okay. But has that changed a lot over the course of like 30 years or so? Because 30 years or so, I knew people that had back surgeries and did not go well, and their fusions and stuff like that. So has that changed a lot based on technology, or is that just typical medicine type stuff?
Well, I think the principles of spine surgery go back 100 years. But when we look at the technology that's developed specifically in my time, I've been in practice now for 16 years. So in the past 20 years, just leaps and bounds in the technology, more of a move toward minimally invasive surgical procedures. I mean, 20 years ago, somebody would have a spine surgery, be in the hospital for a week, told to remain in bed for 3 days before they mobilize them, and we know that's a really bad idea these days.
Right.
So even when I do bigger surgeries, we're mobilizing those patients immediately following surgery.
So looking back on that now, isn't that crazy to you?
It really is. I mean, and I hear all these crazy stories of how, doctors used to smoke in the nurse's station in the hospital, and that's just such a bizarre concept to me.
So in the back of my mind, they reached out to me and wanted me to talk to you. Like, I always have this in the back of my mind that spine surgery, back surgery is scary because so many things can go wrong, and maybe that's just what dealing with those conversations I had years and years ago. But it sounds like you're telling me it's just nothing to be as concerned about as.
So I think
you know I'm coming from here.
I do. So I say this to patients all the time. They're coming to me scared with the same fears you're describing. And I say, look, this surgery is a major life event for you. For me, it's Tuesday.
So what are you seeing the most of?
I see a lot of degenerative problems.
Okay.
Even in younger patients in this area.
Is that something you can actually fix, though?
Absolutely.
Because what I see here is that the actual tissue or the bone or whatever is fading away because it's degenerative. But can you replace that, or how do you fix something like that?
It depends on what the patient's issue is.
Okay.
If they have maybe a specific nerve that's compressed causing the majority of their pain, I may be able to do a very minimally invasive surgery and go in with a microscope and just decompress that individual nerve.
Okay.
Or patients have developed really severe arthritis and their spine has become unstable and is moving abnormally and crushing the nerves, those patients may need a fusion surgery to stabilize that area.
So when should someone like me see you? Because I bet 90% of the population has some sort of back discomfort. Just lifestyles we all lead. But when as far as going to a therapist or chiropractor or something like that, when is that decision? Should I make this? It's time to go see Dr. Meinhardt.
Yeah, I see patients at all stages in their course. Some people just are kind of looking for information and want an expert to guide them in what's going on. Some people, like maybe they have a massive herniated disc that comes on all of a sudden and now their leg doesn't work and they can't walk. Those people need to see me immediately.
Right.
Patients with fractures. See a lot of elderly folks with osteoporosis that develop fractures. I can do minimally invasive surgery to fix that fracture and their pain goes away immediately.
Yeah.
If I can't do that within about the first month, the fracture heals to the point where I can't do much with it after that. So,
is there situations where someone comes to see you and you say, you really don't need me yet, or you probably should go this path?
Yeah, I just saw a gentleman the other day who has spinal stenosis, a lot of compression of his nerves, but he's highly functioning. He's doing everything he wants to do on a daily basis. It bothers him intermittently. So I told him, I said, look, I wouldn't recommend surgery at this point. Let's try all of our conservative treatments first. When it gets to the point where quality of life is affected and every day is just no fun, that's when I'm ready to intervene.
Are there things that we can do at home or to try so we never have to see you?
Yeah, that's a great
question.
question.
No offense, doctor.
Sure, no, that's a great question. So preventative stuff. Smoking is a number one risk factor for
back.
For degenerative issues in the spine, as well as everything else we could list here health-wise. Maintaining physical activity, good exercise regimen, and I don't mean be an Olympic powerlifter per se, but just good continuous exercise, healthy body weights, controlling chronic medical problems, diabetes, different things that contribute.
So it sounds like just about every doctor I talk to, it is the exact same list of things, just basically living a good, healthy life.
Yeah.
Am I wrong there?
Healthy diet, whatever diet you pursue, maintaining a good protein intake, low caloric intake, so you're not overeating calories and putting weight on.
Okay. How much does AI play a role now in what you're doing?
I use AI in the office with every patient I see. I have an app that will essentially record the entire conversation and then help me generate my note. Now, that doesn't replace me looking at my note. I still have to edit every single note that I do. I read all of my own MRIs and x-rays and everything. AI is not as good for that, but like the history component, when I'm sitting there having the conversation with the patient, it's really amazing what it picks up on and then synthesizes into a format I can use.
So you offer some sort of ablation that a lot of people may not be familiar with.
Yes, so this is a procedure that has not been done in this area before. It's called a basivertebral nerve ablation.
Yeah, that's what I thought it was.
Yep, so you got it. You nailed it.
Yeah.
The research on this procedure goes back a few decades. Clinically, it really came out a few years ago when we were able to do it. And this is for a select group of patients that have had chronic, pretty isolated back pain, no nerve symptoms shooting down the leg or anything like that, that have a bad disc problem in the lumbar spine. Has to meet certain criteria based on an MRI and the history and all that. But this is a minimally invasive procedure where I can make little tiny incisions and go under live x-ray into the middle of the vertebral body where this basivertebral nerve lives. The sole function of that nerve is to transmit pain signals to the brain to say this area hurts. So it's one of those nerves that we can safely kill. It does not provide any useful sensation. It doesn't power muscles. So I can ablate or kill that nerve above and below whatever disc I'm targeting, and that can completely take the pain away.
Okay. Interesting. So it's only that portion of the back where you do that ablation for that one nerve?
Currently, based on the FDA approval, it's L3 to S1.
But it could be move up the spine at some point.
I don't think it'll ever get up into thoracic and cervical spine because of the anatomy, but yes, I have had one patient off-label that I went up to L2-3.
Wow, that's crazy that you can do that.
The beauty of this nerve is it does not come back. So
why do we even have it?
Yeah, that's an interesting question, and that's been debated. So this nerve was anatomically identified like over 20 years ago, And the initial thought was, well, this just doesn't do anything. Well, everything in our body does something, right? So this was sort of rediscovered about a decade ago, and some very smart people came up with this procedure and then very carefully did prospective randomized controlled studies on it and rolled out the procedure for us to do clinically probably about 3 years ago now.
Well, thanks for coming in.
Absolutely. It's been a pleasure.
Philip Meinhardt,
Yes, sir.
physician, doctor, orthopedic surgeon with Quincy Medical Group. This has been the Business Spotlight, brought to you by the Bank of Springfield.
Sometimes life throws bold moments at you, like finding the perfect vacation or finding the ideal location. At BOS, we're there to help you meet those moments with bold confidence. So whether it's managing money for future plans or getting what you need to start planning your dream, we're here to bring you a better banking experience. Make the bold move and switch to BOS today.